Can you see the screen?
Yes, sir.
Yes, sir.
Good. Fine. So, last class we saw what are the investigation till there, no? Hello.
Yes, sir. In the last class, we saw
Yes,
the
sir.
MRI and
So,
the gland
Shanlab,
lesions. Hello?
Shanlab,
Huh, sir.
Shanlab, listen. You be on microphone, okay? Don't mute your microphone. So, if I ask question, then I can understand whether you are hearing or not. Otherwise,
Okay, sir.
okay, fine.
Okay, sir.
Okay. So, you respond whenever things are there. Or if any other one are to ask, I will ask by name. Okay. Clear?
Okay, sir.
Okay. So now we'll see everyone concentrate. Now we'll see the management of multiple sclerosis patient. So basically, other than medical management, we have to do the rehabilitation part in the multiple sclerosis cases. Till now, you have understood that multiple sclerosis is a chronic disease and which cannot be cured completely. So, during our rehabilitation process, we have to keep in mind certain things. So that's why we have a rehabilitation framework by different type of rehabilitation system. So first thing in that, okay, before the types, so what are the consideration or what are the things we have to keep in mind before starting any rehabilitation process? So first thing is the chronicity of the disease and the variable and unpredictable course of the disease. Like you have seen the different types of multiple sclerosis, there is it's not similar to each of the types and the course of the disease. That means some are relapse remitting, some are the primary progressive, some are the secondary progressive. So their course of the disease also is unpredictable, changeable. Is it okay, Sanlab?
Yes, sir.
Fine. Sure. So in these cases, we have to keep our aim basically to enhance the level of activity. So we are not tend to completely cure the disease. That is not the aim of our rehabilitation process. Is the aim is how we can do the increase the level of activity of the patient and their participation in daily activities or in their employment. So first method of rehabilitation is the restorative intervention. So restorative means this by improving or remediating. So that means if there is some impairment or activity limitation or participation restriction, so we can rehabilitate to basically to gain back all the normal physiological condition or the whatever activity they are not able to perform. Now we can restore back. So these are the things acutely when you are seeing a multiple sclerosis or a multiple sclerosis patient with a initial relapse remitting condition. For them, this restorative intervention can be possible. So where we can restore the functional level of the patient. So like we can do the strengthening to improve the balance and gait. So till where we can strengthen the muscle when it is indicated, then we can get back the balance of the patient or the normalize that get of the patient. So like this is the restorative intervention. Next is preventive intervention. So now you may not uh, the, the the process of the disease cannot be controlled. So there is a chance of any impairment to be generated. That's why our second aim will be to maintain the potential complication which can be secondarily occur due to this multiple sclerosis disease. Then you have to decrease the impairment which is going to happen. Then you have to restrict the activity limitation. That means limited activity will be performed slowly. Obviously, if there is impairment and all, patient cannot perform their activities as they were doing when they were normal. So this is the phase where we do the secondary prevention and tertiary prevention. So who is going to tell about what is secondary prevention? Anyone can tell what is secondary prevention? Telling? Right, let them tell. Hello, Chandab.
हाँ सर सर
What is secondary prevention?
सर ना सर এটা পারবো না
If it probably
Hello, sir. Secondary prevention is early diagnosis and treatment.
hello, who is this?
Hello,
Yes.
sir. Shireen.
Okay, yes, tell.
Sir, secondary treatment is early diagnosis and treatment.
Okay. So I'm asking to you only what is primary prevention?
Primary is taking the basic levels of prevention like eating well, avoiding the disease.
Basically easy that before occurring the disease, whatever preventive measure you take not to do the not to get the disease. Okay. So like in the COVID and all, we are wearing the mask, we are washing the hands, we are using the sanitizers. So these are the primary prevention, isn't it?
Okay.
Yeah. The secondary is like in COVID, like after person get the disease, then we are quarantining that person not to spread the disease. Okay, so that become the secondary prevention. Or we are giving the medication to the patient to be cured. Okay? So then what is tertiary prevention?
Sir, it tends to reduce in the impact of the disease is having. It tends to decrease decrease the impact of the disease.
Basically, impact of the disease. That means due to this disease, there are some issues. Like in COVID, again, like due to the infection, there will be respiratory issues. There will be respiratory failure and all those things. Okay, so that can be prevented. So that is tertiary prevention. So in the case of multiple sclerosis, so basically due to the disease, we have seen what are the main symptoms are there. Due to that symptom, patient is not able to walk. They have to be bedridden or wheelchair ridden. Okay, so those are the things we have to prevent. So that become the tertiary prevention. So these are the things we include in the preventive intervention. Then comes your compensatory intervention. So that means here the impairment has been happened. Okay, so we couldn't prevent the impairments. So we modify the activities or whatever the environment of the home environment or the work environment. You have to change to bring the person at least near to the optimum functional quality, or where person can perform the activities with some compensatory measures. So this can be focused on regaining or maintaining the function for that particular affected of multiple sclerosis. And lastly, we have the maintenance therapy. So what is this? This is a series of occasional clinical, educational or administrative service. So that means it may be clinical basis, it may be education for the patient or the patient parties, families, and it may be administrative service like from government or non-government organization. They can design to maintain the patient current level of functioning. That means just this is the maintenance. Whatever patient has remain function, so we cannot gain the newer or we cannot go back to the normal function. But whatever has been maintained till now, that should not lose by the patient. So for that, whatever measurement we have to take. Here, now we are going to discuss particularly in multiple sclerosis cases, what are the PT management according to the different symptom, what are the things we are going to do. So first thing, as I said before, the management, in the management always you should do assess the patient to gain different information about the disease as well as the patient related environment and all those things. So before any rehabilitation, you should know about the disease condition of the patient as well as the environmental structure available to the patient. Then only you can do the proper rehabilitation process. So in this, so obviously you need to know the patient history. So where you have to know the current condition and the complaint of the patient, whatever medication they are taking, then the whatever test result they have found, or whatever MRI and all those things is suggesting. Then you have to know the functional status and the activity before the disease as well as now what is the condition. Then comes your test and measurement of impairment. So for different system, we have to do the assessment. So first thing is the cognition, cognitive level. You have to know of the patient current cognitive level. You have to know. Then communication, if there is some speech problem and all this thing. So then you have to know that how the verbal or normal communication can be possible currently. Then other bodily characteristics like BMI, girth of the limbs, then if any length of changes in the limb and all those things has to be measured. You need to know about the circulation. So because like some of the patient after the acute onset and all those things, they are patient when they are bedridden. So from there when they sometimes try to get up and all those things, they have a chance of postural hypotension and all those things, orthostatic hypotension. So you have to know about how is the circulation happening, or there may be, if it is for a long time they are bedridden, there may be chance of DVT and all those issues. So you have to keep in mind about the circulation. Then you need to know about the aerobic capacity, endurance of the patient. So if you want to suggest some, the fatigue is a very important symptoms of the multiple sclerosis. That's why whenever you are suggesting some exercise, before that you need to know how is the capacity of the patient to tolerate all those exercises. For that, you need to know the aerobic capacity and endurance. Then you need to know about the skin condition. So for that, you have to keep on checking the different pressure points in the skin where the chance of bed sore or decubitus ulcer is possible.
Sir,
Yes.
sir, orthostatic hypotension is due to prolonged rest in the bed in the latest stages. Is that so, sir?
Yes. Yes. Orthostatic means when patient is in a supine lying. Okay. That time, if suddenly a person get up from the bed, what happen? There is peripheral cooling of the blood. Okay. So what happen? Heart cannot pump the enough blood to the brain. So or cannot take back the blood from the lower limbs, okay, or lower portion of the body. So it cannot generate the vital amount of blood in the other area of the body. So there is a fall in the blood pressure. That is orthostatic hypotension.
Okay, sir.
Understood?
Okay, sir.
So one reason is because in vein, when you do the lower limb movements or the muscle is contracting, it gives a venous return. So if those muscles are not contracting for a prolonged period, so that characteristic of the vein to give the blood back to the heart is decreased. For this hypotension basically happens. Okay, so then coming back, so you have to check the sensory integrity of the body. Like you have to check all the sensations because there is a chance of sensory loss also, or there may be altered sensations. Then you have to check the pain, the site of the pain, and the how much is the pain. So that intensity and the location of the pain need to be known. Then you have to check the muscle power, strength, and endurance. So all three are important. It's not only the strength is required, because here if you check, if you do MMT, so if you ask the muscle to contract for a single time, patient may perform it good. But when you check the endurance for a prolonged time, muscle has to work, then it will, there will be very early fatigue. So you may not get that much of endurance. That's why you need to know all this strength, power, and endurance in all of the muscle. Then you need to know about the how much is the motor control or the motor learning possible, because motor control will be hampered because there will be spasticity, there will be other tremor and all those things. So that may decrease the control of the performed movement. So that has to be checked. Okay. Then due to all these things, there will be altered in posture. So patient may not maintain a erect posture for a prolonged time. So there may be deviation in the posture, or even balance and all those things during the functional activity or the during the walking process. So for that, you need to also know the safety measures which has to be which are there or not in the environment where patient is living. Then you have to analyze the gait and the locomotion. How is the gait pattern? How is the speed? So obviously, patient will have a slower speed, and is there any chance of fall and all those things during the gait process? Then functional status and activity level of the patient. That means activity of daily living. Patient can what all the function can be performed at home or at the job place, so that has to be noted. So ADL mobility skill, home management skill. Then psychological function, as this is a chronic disease and also happen basically in a younger age. So obviously the psychological factor is a very important thing because like for a younger population, they lose their function in the early stage of life. So obviously they will be very much depressed or anxiety will be there. So that has to be keep in consideration before you start any rehabilitation. Then you have to see if there is any assistive device or the adaptive device which are already there for the patient. So that has to be considered. Then very importantly, you have to consider the environment, that may be home environment or the work barriers. Those has to be considered before starting your rehabilitation process. So anyone has any doubt till now for the assessment or we have to do in the multiple sclerosis? You can ask now.
Sir,
Yes.
yeah, sir, patient sometimes tries to hide his tremor by keeping his hand in his pants or something. So it both affects his psychological function and also the tremor. So can we do anything to counteract both of these? So
Patient keep the hand in the pocket.
exactly. So he or she tries to, hide the tremor.
No, this is not actually to hide the tremor. I think it's like if they keep it like tremor in this case of multiple sclerosis basically happen when they will do the function, isn't it?
Yes, sir.
Intentional tremor. Okay, so if they keep it in the pocket, it will be in the rest, so automatically the tremor will go off.
Okay, sir.
Yes, sir. Not basically it's the height. Patient has seen that okay, if you keep it in the pocket, then the tremor stops. So it's a preferable thing for them.
Sir,
Yes.
sir, bladder assessment কি করে করব স্যার?
Who is this? Richard. Tell.
Sir, bladder assessment.
Okay, bladder assessment will little bit discussed when we're doing the bladder management. So basically here assessing is like so there will be a spastic bladder obviously. Okay, so for that there is like what you call is incontinence where there is patient will have a arch incontinence. That means whenever a little amount of blood urine is present in the bladder, patient get the urge to urination because it is spastic bladder. So it's like a small balloon. If they get the little bit, it has a it give a reflexive micturition or micturition reflex. Activate the micturition reflex. So they get the urge for urination. So for
Hyperactive.
yes, actually, like all other muscles, spasticity is there. Same like in bladder also spastic is there. Whenever some amount of urine comes, it activates the micturition reflex.
Okay.
Okay, so for that you have to check the you have to take the history of that. Okay, so patient will tell like how many times you have to go for the urination and all those things, how much amount of urine you take out. Okay, that measurement has to be kept. Then if any other activity may cause the like accident in the urination. Okay, so like if any pressure on the abdomen and all this thing may cause the urination. Okay, so all those things you have to take the history and you have to do that. Right? More details we will do when we are seeing the management. Right? Any other question?
Hello, sir. Do we do CSF study in this or investigation? In investigation?
Actually, for diagnosis purpose, they do the CSF because to rule out any infection or like meningitis, because the symptoms kind of initially may overlap, no? So that's why they want to rule out any CSF infection or there or not, and meningitis or encephalitis type of issues are there or not. To basically to rule out, they do the CSF analysis. Okay, for diagnosis purpose.
হ্যাঁ,
Yes. Yes.
স্যার বলছি যে কোনো ক্রেনিয়াল নার্ভ অ্যাসেসমেন্ট করতে হবে নাকি এখানে?
Yes, obviously. Okay. Cranial nerve are also like not nerve itself is involved, but the cranial nerve function may be involved. Like upper motor type of cranial nerve involvement will be there. Are you getting my point? So it's not like a lower motor, like you have seen in the facial nerve, there is chance of upper motor type of also. So in
supranuclear.
there may be supranuclear palsy of facial nerve also can also happen.
সেখানে সুপ্রানিউক্লিয়ার পালসি তাহলে দেখা যেতে পারে।
একদম, yes. We'll continue.
Okay.
Okay, fine. So coming to the sorry, coming to the physiotherapy management. So first thing we need to consider about the sensory deficit. Very important. So doing any of the activities before you need to know how is the sensory status of the patient. So a patient also should be aware about the sensory deficit. Otherwise, there is chance of injury to the skin and different part of the body. And patient should add up some compensatory measurements to basically deal with the sensory loss if there is already sensory loss. And they have to keep in mind that safety, like as I said, there may be chance of injury to the skin or the other body part can happen. So like if someone has a problem with the proprioception, so obviously they will be having a imbalance during the gait and other functional activities. So they can compensate that by visual over concentration. That means whenever they are doing some function, they maintain a constant visual observation while doing the activities. So they will be having the less chance of fall or imbalance. Then skin care, very importantly, skin has to be clean and dry. Clothing should be breathable and comfortable. Then regular inspection has to be done. Basically, is there any chance of formation, any bed sore or pressure points? So that has to be under the regular inspection by the patient party, everyone. So you have to check for any redness in any area, basically the bony areas. Then a patient should know about the regular pressure relief process. Like if patient is sitting in an area for a prolonged time, they have to release. So they have to get up after few minutes, and like if they are in the wheelchair and all these things, they have to lift their buttock by pressing on the handrail. So like that, you have to keep on doing this pressure relief techniques at least after 30 minutes or 1 hour period. Or if they are lying for a prolonged period, they have to change the position. So all this pressure relieving technique has to be used by the patient, so that there is no chance of formation any pressure point or the pressure source. So these are the different pressure relieving devices are available. There are mattress, so which may be of water mattress or air mattress or gel mattress. So those are help in shifting the weight of the body, so that there's less chance of a pressure in a particular point or in the bony area. There are foam or the air cushions, cuff, boots. Okay, so these are things. There are like this cushions, cuffs, or boots is used for different part of the body. So they are there. There are cushion for the shoulder blade, elbow, ischial tuberosities, sacrum. So like this, for malleolus, like they can use the pressure relieving boots. Okay, so these are things which can be used. So you can see these pictures. If you open up the book, you can see there are different picture of the this pressure relieving device, the silicone. Okay, next is pain management. Very importantly, you saw there are different type of pain and altered sensation present in the patient. So you need to do the regular stretching or exercise, massage to reduce the pain. Patient can or relieving the patient pain can use the warmth by like hot uh, hot pad or anything kind of that they can use, but they have to be keep in mind that there is sensory issues there, so they have to be very careful on that part. So that's why this neutral warmth is basically more helpful. Then they can use the TENS also, but again for the like TENS has a little controversial result. So that's why like if it is giving the pain relief, then it can be used. Otherwise, sometimes what happens, there is a stimulation in the nerve, so obviously there is a chance of further fatigue of the process of the nerve. So that's why it may cause increase in pain also sometimes. You have to be like careful during applying the TENS. Again, another reason for pain is because of the decreased movement of the body can cause the decrease in the circulation. So basically from the calf or thigh muscles, if they are not moving for a prolonged time, so the circulation is decreased. So that's why they may cause a pain in the whole leg. So for that, you can use the pressure stockings and gloves, so that there is a constant good venous return, and so the blood circulation will be of ease. Then you have to retrain the posture. So you have to make the patient understand how is the normal posture and how to maintain or correct the abnormal postural move or the movement. So different instrument or the devices can be used for maintaining this posture. So like you can use the soft collar to limit the neck pain or relieve the alarming sign. Okay, so can you tell what is alarming sign?
স্যার নেক ফ্লেক্স করলে পুরো একদম স্পাইন নিচ অব্দি পুরো ব্যথা চলে যাবে।
Basically, that is the causing the stretch in the meninges and all those things by flexing the neck. So that causes a severe shock-like pain in the whole body, basically in limb and lower limbs. So that's why they will prescribe the soft collar so that it doesn't cause any sudden flexion of the neck and is maintaining a proper posture. Then it is a there is a prolonged pain throughout the day. There is a pain in the patient, so that's why the patient will be under the stress. So that has to be also managed by different relaxation methods and the education of the patient that how to relieve all those things. Then hydrotherapy is a very good method to decrease this pain because that gives an overall water activities and relaxation because of the warmth in the water and all those things. This is also of good health to get a gross management in the hydrotherapy pool. Then other motor symptoms, you have to do the strengthening and conditioning. So obviously for this you have to keep in mind how is the condition of the patient, how much is the optimal strengthening procedure will be there. So like if you do a higher intensity strengthening which may cause the deterioration in the condition, so you have to keep in mind. Or if you are not doing the optimal strengthening procedure, so obviously they cannot maintain the as much possible strength they have. Okay, it will decrease. That's why you have to understand what is the optimal for that particular patient and how much repetition you should go. That has to be decided in each session. You have to decide on that. So you have to keep on observe the changes in the strength of the patient for deciding the intensity of the strengthening or the conditioning process. So usually this strengthening is scheduled in alternative days to give a rest to the muscles, and you have to decide the optimal time and duration that we discussed. Then another very good method of strengthening is the circuit training. So because you are changing the method of strengthening process, so they can do the like weightlifting some amount, then they can go for the cycling, they can go for the another aerobic activities. So like that, they keep on changing so that different type of muscle get involved in this, and other muscle also get rest for the time being. So that's how you reduce the chance of fatigue in this patient. And you have to keep in mind your progression is not like you are not going to cure the patient in a matter of time. Okay, so this is a prolonged process, and it will be an all-time process or rehabilitation process for the patient for lifelong. So the progression of the strengthening or the like your treatment process has to be gradually improving. It's nothing like a sudden increase in the progression are not going to help the patient. And another thing very important, this fatigue has to be monitored very effectively. Otherwise, you are going to cause the deterioration in the patient more than the improvement. And another thing you have to keep in mind, like during the exercise, obviously our body temperature increases. So in these cases, temperature has a very important role in getting the fatigue. So if you are not giving the proper rest time during the strengthening process, so the muscle or the body will be increasing the temperature, so they will be having the fatigue very, very faster. So you have to give proper rest time during the exercise process. And better you can use some functional activities for the strengthening purpose. It's not like you're giving a dumbbell all the time to strengthen the muscle. So better you give some particular function. So lifting some foam objects which they are using daily. So that will give the strength as well as the functional re-education also. So you can give some posture activity, the squatting and all those things. So those are more helpful and that gives the overall activities of the different muscle in the body. Then obviously you have to work on the flexibility of the joints. There is chance of different muscle get tightened and there is spasticity also. So for that you have to do the proper stretching. Obviously not a very fast stretching process. You have to be slow and sustained. Stretching has to be given. You have to do the full range of motion exercises for the different joint where there is chance of more tightness. Okay, so pull muscles may given for upper limb and lower limb, so you can read that. Then your cardiovascular conditioning is very important again. Like their overall aerobic capacity will be decreasing. So for that, also too, other than the strengthening and all those things, you have to condition the cardiovascular system also. So for that, again, 2 to 5 days per week is given. So like better you go for, like you saw, there is a strengthening process is given alternative day. In other days, patient can do the cardiovascular conditioning. So like that, you have to decide on the exercise protocol. So the session should not be very long session. So usually it is 30 minutes per session. And in that also again, 10 minutes session per day. Okay, so in a 3 parts, that means they can do it in the morning, noon or afternoon, something division they can do, and where they can only do for 10 minutes of exercise, so they get a proper cool down of the activities. And again, training intensity should not be more than the 60 to 85% of heart rate peak or 50 to 70% of the VO2 mass. So activities like cycling, walking, swimming, and in hydrotherapy water aerobics, those all can be done, but obviously it has to be properly prescribed according to the availability or the condition of the patient. Fatigue management, very important, like fatigue during the whole ADL, how they can compensate or how they can deal with this fatigue. So obviously you have to keep this aerobic training and all those things, and they have to understand when patient is like patient selfly, they should understand that when they are going toward the fatigue, so they have to stop at that point. Okay, so all those things has to be understood by the patient also. So the very important method, there is something called energy effectiveness strategies. In that, they have to have a diary. So all activity they have to perform daily. So during the activities or the without the activities, there should be a proper gap between the different activities, so they can maintain that. And activity pacing, like example given, the balancing of activity with rest period. So that means when they have to do the prolonged things, like they have to cook for a prolonged time, so they cannot the things in a continuous process. They can do some activities or some amount of dishes they can make initially, then they can take a rest, then they can go for further. So like that, anything during all the activities, they have to take lots of rest so that they can perform the activities properly. Also, therapists has to keep in mind that they cannot give all the exercise in continuous session or like that. So they have to pick between the different activities or they prescribe them. Okay. So already we have discussed, like one day they can go for the strengthening, one day they can go for the conditioning. Even in the session, like they have to break up into 15-minute session, then put rest, then they can perform other. Like that, they have to prescribe the exercise so that the fatigue doesn't occur. Capacity management, basically the upper limb and lower limb, anti-gravity muscles, they get the strong spasticity. So anti-gravity muscle like quad, lower limb quadriceps muscle or the gastrocnemius muscle. So those are the muscle which get the very strong spasticity. So that hampers their working process or the functional activities. So for that, you can do the cryotherapy for a prolonged time. That will decrease the tone of the muscle. Then you can do the slow, sustained stretching or positioning. Like you must have seen in the boba, there is something called what is there, Sangam? What do you do in boba to decrease the tone?
Sorry, sir. Repeat.
In boba, they do some particular things, no? To decrease the spasticity or tone.
RIP.
Yes, reflex
RIP,
inhibiting postures or patterns. Okay, so those are the things you can do to decrease the spasticity. Then you have to give exercise, which are also will be helping in the decreasing the spasticity. So you have to do the full range of motion in either way. So like for the agonistic muscle and antagonistic muscle, so that it gives the whole range of motion and that is maintained, and you can decrease the spasticity obviously. So if automatically if biceps has the spasticity, so if you do a proper movement for the triceps, if you contract it, obviously they will give a reciprocal inhibition to the biceps. So that's how you decrease the spasticity. Then conditioning, coordination and balance. So here it may be of two types: static control and the dynamic control. Static control means maintaining a particular static posture, like sitting, standing, or like that. All those and depending on that particular position, and they are not deviating on that. So you have to train that also. Other than that, you have to work on the dynamic postural control also. That means patient may be free, but when they are going to reach for something, they may fall. Okay, they are not able to maintain the balance. So that's why you need to work on the dynamic postural control also by incorporating the different weight shift. Like patient can shift weight from one leg to another leg, or when they are sitting from one buttock to the another buttock, so they can shift one side, keep changing posture. So all those activities will help in the improving the dynamic balance. Upper limb reaching right, sitting on the ball. You can see this picture. Sitting on the ball or sitting on a stool or the bed, they can reach out for some object with holding something in the hand or without holding anything. So this will help in the all things together. So it will give the reach out, it will give the weight shifting, and controlling the ball. So all those together activities will help in the control the dynamic posture control. Then you can do something called resisted bilateral PNF. So some people had the doubt on this. So like this is doing the diagonal activity in a bilateral pattern. Okay, so here you can do the chopping activity, like person is cutting some object in front of that. So how they will do that diagonal movement of the upper limb. So those has to be done. You can see in the picture, you can give a TheraBand also. So here you can see they're using a TheraBand in a diagonal pattern to strengthen that, as well as the person is sitting on a ball. So that gives the truncal stability. They have to maintain the truncal stability. Along with that, they have to do this resisted PNF. So in the other, this one, this picture, you can see like therapists are sitting back and giving resistance while person is performing this bilateral. Both sides, they are crossing the hand. So this is called bilateral PNF. You can do that, those things also. So ultimately, all these activities is to improve the function. So, so by doing all this physiotherapy intervention, you have to improve function. So for that, we maybe need to give some training in the functional activity, particularly for dressing or personal hygiene, bathing, toileting. So all those has to be given, how to feed them or in by himself they can to eat the food. All those activities you have to teach them. Sometimes maybe happen they cannot do due to the impairment and the disability, whatever they have already got it. So for that, you need to advise some adaptive equipments, like different names has been mentioned there. You can see. Then you have to work on the locomotion or the gait of the patient. So standing, walking activity, you have to train, you have to do the gait training, you have to work on the safety measures, how they can maintain a stable base of support. So you have to keep training of that. There should be like proper weight bearing in the different lower limbs. Then you have to give the walking training, forward, backwards, sideways, or cross stepping. You can see in this picture, cross stepping. When they can perform the forward, backward properly, sideways properly, then they can go for the cross stepping. So some patient may need the orthosis or assistive device like A4 and all those things, then wheelchair or the gaiters, all those things can be advised if required. Then management of the speech and swallowing. So basically it's the work of speech pathologist, but obviously you have to have a collaborative work with them. So you can teach the patient how to maintain the breathing process during the talk or during the swallowing process. Another important thing, like during the or the speech, should maintain a proper posture that helps in the all these activities. So that's why you may work on the trunk stability, head control, and all those things, so that they have a better improvement in their speech and swallowing. And also there is a method of using stimulation, neuromuscular stimulation on the submental muscle, facilitated the reeducation of these muscles. So basically, you can apply electrode over the throat. So you can see in the subhyoid triangle, you can use some electrode and give the stimulation. So that's helping the muscles of the swallowing and the speech. Then you can give some oromotor exercises like tongue movement or like some produce some sound like and all those things. So that help in the if train the swallowing. Okay, if you understand the patient about the phases of swallowing, so you can train them all these things so that they have a better speech or the swallowing without choking and all those things. Bladder management. So as we discussed a little bit, so in these cases we have the spastic bladder. So you need to know about how is the voiding time of them, like how is the frequency of the voiding, how much is the body volume and all those things. So you need to know all those. Then you can suggest the patient about this something called time voiding. Like it has to be fixed. Like patient cannot go any time for voiding. They have to maintain a particular time, depend on their like their possibility. So that will help to get a schedule of their bladder emptying. Plus, they can do some dietary management, like when to take a good amount of fluid. Like if they want to go for the sleep in the night, before that they should not take any fluid, so that that will cause their like they have to get up many a time during the sleep. So that's why they have to maintain a fluid chart. So when they have taken out and how much is the output, depend on that, they can control their total dietary and the fluid management. And there are different training program, like you know some of them. There is like Kegel exercises to basically strengthen the pelvic floor muscle. So you have the different pelvic floor muscle on different position. They can do that. So that has to be done. Then there are something called biofeedback, like EMG biofeedback also. So basically they apply some EMG electrode over the pelvic floor muscle, and they ask to contract those muscle so they can understand how much contraction this person can produce. By that, they give the training. Then you have the chance of giving electrical stimulation if there is a weakness that can be done. There is something called vaginal cones, basically to strengthen the pelvic floor muscle. Then if all this thing, like sometimes there is a weakness in the bladder muscle or the like basically external sphincter muscle and all this thing, there is chance of incontinence. So for that, yeah, they may use some protective equipments so that they don't get like with the incontinence, they will be having a accidental urination. So all those can be controlled by using something called incontinence pad, or there are some protective equipments, like if they are bedridden, they have to use mattress which are not like they won't get wet very easily. All those things. So these are the equipments which has to be used to avoid soiling of the things. Then you have the cognitive training. Though we work very less on these things, but you have to keep in mind like these are the important measures patient also should take. So you can collaborate with the different mode of healthcare system. Like here you can work along with the psychologist and all those to basically work on their memory deficit. So they can be prescribed some memory aids. Okay, so or they can note down or maintain a schedule of their cognitive activities. So they can use the timing device. They can use the environmental strategies like they can if as the gross memory loss, so they can use some written or printed papers in front of them. So which all activity has to be done after what. So that can be maintained by the different compensatory methods. And there is something called cognitive behavioral therapy. So basically there are some activities which can be incorporated along with the cognitive task. So like something is called like something like dual tasking. So one activity will be cognitive, one activity will be, so during walking you may ask to for they have to talk something or talk anything about their activities or something like that. So this can be incorporated so that they have a like combined training of cognitive as well as the motor level activities. So that is called cognitive behavioral therapy. Then another very important thing in this chronic cases, like support from the caregivers and education of the patient. Like obviously, as we discussed, there will be psychological issues. So if patient understand their condition and how to overcome these things, so and they should have a give a proper optimal hope for the improvement. So so that can be one part of a therapist. Because therapist is with the patient for a prolonged time, so they can work on this all the time. So it has to be assist the patient and the family or the caregiver, providing about the information about the disease and their prognosis, how much is possible. Then home exercise program that has to be taught, like patient has to perform this exercise every day. So that has to be taught to the patient and the family. How to use all the assistive devices and all these things. How to use the adaptive equipments. All this has to be taught to the patient. Then patient should have an idea about their general health and how to manage their daily stress due to this disease. So this are the thing of the physiotherapy management that can be helpful for the administration. So that's complete our management for now. So now we can ask.
Yes, sir. So if pain is present during eye movement, Sir Ritu Patwari. Sir Ritu Patwari. Yes. So if pain is present during eye movement, then how to manage it?
Present during eye movement means?
Means if during movement of eye, if pain is present, then how to
Present
manage
is
it?
in the eye.
Yes, sir.
See, nothing there is particularly about this thing, but obviously, like other muscle also, the eye muscle also may have a chance to early fatigue. Okay, so like they have the ptosis and all those things because of that only. Their eyelid cannot open. So at the later stage of the day or during the night time and all those things, patient may have the issue opening the eye for a prolonged time because nothing but they have the fatigue in those muscles. Okay. Same thing.
Yes, sir.
So you have to basically train those muscle again in a coordinated manner so that that doesn't get fatigue. Okay. So same like other muscle also, you have to strengthen those eyeball muscle also. Okay, you have to give some gaze activities, so like they can do the movement, finger movement and all those things, and patient has to follow the finger and all. So all those exercise will again help to basically strengthen the eyeball muscles. That's how you can decrease. There is nothing specific pain relieving techniques for the eye muscles.
Okay, sir. Sir,
Yes.
then blurred and double vision, all this doesn't come under the scope of physiotherapy. So we can't treat them, address those symptoms.
No, actually, that's a thing. Uh, uh, it is not completely under your obviously is there because double vision and all those things are also related to the tone of these muscles. Okay, so which you cannot control, but obviously the coordination of the muscle is your domain. Okay, where this gaze control exercises. Okay, you must have seen the picture in the eye exercise chart in the clinics. There is a chart, no? Eye exercise. So all those you can do basically to improve the coordination and all those things. But obviously, the patient is kind of some patient compliant for few days, like relapse remitting type. This optic nerve is involved. Then patient may be blind or has a tremendous problem in vision. All those cannot be controlled by the or managed by the physiotherapist. Okay.
Okay, sir. So is there any role of stem cell transplant in this, in the medical management?
That is there. So see, all the stem cell management are under research only. Okay. Like in few cases they have seen some improvement, but it's not particularly still there is some confirmatory stem cell therapy for multiple sclerosis.
Okay.
Sir, can you please repeat the resistive breathing training for once?
This you know in your second year only. Okay, if you remember the breathing exercise, do you remember that resistance exercise for the diaphragm and all, or for intercostal muscles? How you do?
Okay, sir, normal जो breathing exercise, all those glossopharyngeal breathing.
No, no.
अच्छा.
Yes, diaphragmatic exercise করা যাবে
কিভাবে? Resistance.
তাতে কুক লাইন এসে হাত দিয়ে
Has a
Keeping
patient
weight on
abdomen
the-
के ऊपर pressure देना.
Shirin is telling something.
Yes.
So keeping a weight on the intercostal area,
Yes,
diaphragmatic area.
So you can keep a weight on that, and then you can do the diaphragmatic breathing and all those things. Okay, so those are the things. Okay, you can like there are some what do you call instrument also, something called a cappella. You have that simple that what do you call spirometer. Okay. So those exercise basically help in the resistance training. You can see now in spirometer, have you seen? They have different balls of different volume resistance. Okay. So that if they take one, then it is somewhat 600 volume, 600 ml. Then next one every 1200. So like that, you are increasing the resistance in the breathing. So that's how you train your breath. Okay, so they can hold the breath because wherever you are talking or wherever you are swallowing, you have to hold the breath for a certain period of time. So this training will help them to control their breathing during the feeding and speaking. Okay.
স্যার স্ট্রেনথেনিং এক্সারসাইজ কি ফার্স্ট ডে থেকে শুরু করতে হবে না?
First day and last day is everything
না,
depend
sir.
on patient when patient come to you.
স্পেসিফিসিটি তো থাকবে।
That can be there. So your strengthening process has to be which muscle you will strengthen, that you have to decide. Okay. So like if you think like there is biceps,
স্পেসিফিসিটি থাকলে তো করব না।
no, it's not that. Spasticity, if it is too much spasticity, okay, that's why
Mass
we have the grading of spasticity. That's why. If it is mass 1, obviously you can start with the strengthening. There is no issue. Okay, but if it is 2, if it is 1 plus 2 or something like that or above that, obviously in that case you cannot do it. So everything depends on the condition. It's like whichever management we have talked, it will vary to the different patient. It's not compulsory. All of these things are compulsory for all the patients. It's not that. So everything will depend on your assessment when to start which one.
So,
Okay.
but is there anything to continue throughout the process?
What thing?
Like a resistive, little bit of resistance exercise and something like that.
No, that's what I think. First, you have to observe like how much is the spasticity, how much is the fatigability of the patient. Okay. So when you see, okay, certain amount can be maintained, then you can do. Like the person cannot take off 2 kilo weight, fine. You give him half kilo weight to train him. Okay. So like if they cannot perform 10 repetition, you go for the 5 repetition. If not, only 3 repetition. You can start with that. But if you see if patient is getting fatigued easily, then you have to stop that. You can do only the range of motion exercises.
Sir, can we
So like
progress here, or we cannot progress like from half kg to 2 kg, right? Because the disease is also progressing. So
Obviously, yes.
So like we have to degrade our exercises, right, with time?
May not be if patient is improving. So improving doesn't mean patient will get cured, but improving will means like patient is able to do the things more functionally. Are you getting my point? So thing is
Okay.
that patient is obviously in a prolonged time, if you are 10-year span, if you think like patient may be deteriorated. But for period when you can see that like every time there is a patient will like deteriorate, plus patient will come back also, because there is a demyelination followed by remyelination also happening.
So in case of benign
Okay.
multiple sclerosis,
Benign means you can easily do everything. Okay, benign is very lower symptoms, isn't it?
yes, sir.
So there you can do everything. No issue with that.
Okay, sir.
Okay, so basically the thing is that you have to depend on the symptom. It's not all the time it's like disease or the particular types of the disease. It's depend on the symptom at that time.
Okay, sir.
Anyone else? Anything? Any more question? I think there is no question. Shalab will end.
Yes, sir, when will be our next class?
Huh?
When will be our next class?
Next, okay. Polio we need to discuss, or you understood the things? Poliomyelitis.
Sir, it's good right now if you discuss in one session on polio.
Okay, then next class we can discuss on that also. Next class. Friday. We'll do it on Friday
Okay, sir.
or next Monday.
So Friday.
Friday. Okay, fine. And Friday morning we'll do. Fine.
So,
পোলিও পড়াবেন স্যার?
Polio.
ওকে ওকে
so Friday 11 a.m. to?
Same time.
Okay, sir.
Fine. We're stopping.
Okay, sir.